Hello everyone, I hope you had a great Thanksgiving. We're going to go over a little bit of the anatomy of the reproductive system for both male and females today. And so we're going to be jumping around a little bit between chapter 28 lecture and chapter 27 lecture, but I'll try and make it clear which one we're on at the time. So the first one we're going to go over is chapter 28. This is the female anatomy. And as I said before, we're not going to go over a lot of the reproductive physiology aspects. We're going to do that more in class. All right, so here we go. Okay, so we're just going to be covering this first topic up here, reproductive anatomy. The rest we'll discuss later. And what's important to know is the female reproductive system is a lot more complex than in males, which kind of makes sense, right? Because the females are the ones that are not only going to be carrying the fertilized egg, but also developing it into a child, and then later on giving birth to it, and then again sustaining it further through lactation. So it's a lot more complex than the male system. Okay, so the main goals are to produce and deliver gametes, provide nutrition and harbor for fetal development, give birth, and nurse the infant, just like I said. There's more of a cyclical effect, as many of you are aware of, especially with the monthly cycle. And female hormones are secreted in a more complex sequence than the relatively steady secretion of hormones in the male. And that will account for your ovulation cycle, your when you get your menses and your period, essentially. So that cyclical effect is really important in females, and it can get pretty complicated as far as the hormones are concerned. Sexual differentiation basically occurs after about 8 to 10 weeks of development. So a lot of people like to say that the default gender is female, which means as the fetus is developing, there really aren't any genitalia yet. So I wouldn't go so far as to say the default is female, but in the very beginning, there aren't genitalia, so there aren't hormones being produced that determine genitalia, and because of that, there's really no way to tell what the gender is of a fetus at that age. The female reproductive tract will actually develop later on from the paramesonephric ducts. We'll talk a little bit about that. And this is where the default comes in. They say that the female reproductive tract develops because it's missing testosterone. So if you had testosterone, even if you were an XX chromosome, if you had testosterone being produced, you would develop male genitalia. If you don't have testosterone being produced, you develop female genitalia. All right. You also have something being produced called the Mullerian inhibiting factor, and both of these lead to the female reproductive tract developing. Okay. So there are internal genitalia. When we talk about that, we're talking about ovaries, uterine tubes, uterus, and the vagina. When we talk about external genitalia here, these is going to be the clitoris, the labia minora, and the labia majora. Okay? So these are actually the internal organ systems occupy the perineum. Still, that's the internal segment right here. Okay? And when we say the primary sex organs of the female reproductive system, when they say sex organs, they mean the organs producing the gametes or the sex cells. Okay, and those are going to be the ovaries, because the ovaries are producing your eggs. Now, secondary sex organs are going to be pretty much everything else. So internal, other internal, all right, and external genitalia. So just keep that in mind. When they say primary sex organs, they're talking about the organs that are actually producing the sex cells. Okay. So, oogenesis and the sex cycle, we're going to talk about this more in depth later, but for now what you need to know is the reproductive cycle is different than the sexual cycle, okay? Reproductive cycle is the sequence of events from when an egg becomes fertilized to when you give birth, all right? So that 9 to 10 month window is the reproductive cycle. So what's going on during that time? Now, the sexual cycle is what more people are familiar with, and this is basically your ovulation and menstruation, okay? So sexual cycle are the events that occur every month when you don't get pregnant, okay? So if you don't get pregnant, you're going to go through your regular cycle, and that includes your ovarian cycle, so things that are going on in the ovaries, and then your menstrual cycle, basically things that are going on in the uterus, okay? So I know we kind of tie them both together, but since they're two separate organs, they break it down into two separate cycles. So the ovarian cycle for the ovaries, menstrual cycle for the uterus. Okay, so the anatomy of the ovary is actually pretty cool. I know I say that, I'm kind of a nerd, you guys know this. This picture is very helpful. So what happens in the very beginning are you have follicles that you are born with. Okay, you are born with these. Primordial follicles are in, all of them are produced while you're a fetus. You do not produce any more after you're born. Okay, so you have a set number of primordial follicles. Every month, one on average, sometimes two, you get twins sometimes, but on average, every month, one of these primordial follicles will be selected to develop and ovulate, okay? So they first turn into primary follicles, secondary follicles, and then a mature follicle with an oocyte in the center, okay? Oocyte is the scientific term that we use for an unfertilized egg, okay? So, as it continues, your hormones take effect, causing it to grow. It then moves towards the outer boundary of the ovary, all right, and is ovulated. And what that means is it's released into the fallopian tube, and the oocyte is going to travel down, and that will either travel out of you completely or you become pregnant by getting it fertilized, okay? So what's important to know is once this thing ovulates and breaks open, it's not trash now. It actually has a job to do. So the egg leaves, but you have this follicle still moving around, okay? What happens is it turns into this body called a corpus luteum. You'll see sometimes it means CL, they'll abbreviate it. Corpus meaning body, okay, body of something. Luteum meaning white. Remember luteal? That is the Latin for white. So it turns into this whitish, kind of yellowy thing, body. And that is going to be producing hormones on its own to help sustain pregnancy should you become pregnant later on. All right, and then after that, the corpus luteum then moves on to become the corpus albicans. All right, albican like albino, meaning very white. It almost looks like scar tissue. Now keep in mind, both ovaries aren't doing this at the same time every month. Sometimes it alternates. But there are possibilities when you have twins that aren't identical. Many times it's because you've ovulated more than one oocyte at a time. And that's perfectly fine. A lot of times what will happen is a lot of these primordial oocytes will start to develop, and only one is selected to move forward into the final ovulated oocyte, okay? So sometimes two end up being selected, and it just keeps going. Okay, so the egg cell that we talk about are the ova, all right? And the ovaries also produce a lot of hormones. So besides just this, your regular ovarian cycle, you are also producing a lot of sex hormones at the time. That's why women who go through menopause or who have a hysterectomy, including their ovaries, will need to be on special synthetic hormones to try and regulate their body, because the ovaries are very important for hormone regulation in females. Okay. In addition, the ovary is supported by 3 ovarian ligaments, as well as you have artery, veins, and nerves. And as we talked about before, the ovaries have a very high perfusion rate, which means they get a lot of blood exchanged very quickly constantly because they need to have a lot of energy to produce these eggs and to release their hormones. Okay, so then we talk about the uterine tubes, and so many of you guys are kind of familiar with this. Some people call horseshoe, some people call a moose horns shape, but essentially you have the ovary right here, you see it on both sides, okay? And this down here is where your vagina is. So you can kind of orient yourself. You're looking at the anterior view. So here is your ovary, all right? It's going to ovulate the egg into this little cup shape, okay? And this here is the fallopian tube that you've always heard about. You know, you hear your tubes getting tied. This is where they would separate this off so the egg can't travel into the uterus, okay? So this is where your fallopian tubes are. Another name is uterine tube or oviduct, okay? I'm most familiar with fallopian tube. That's what I'll be calling it. Feel free to call it either of the other two names. It's totally fine. So this canal is important for connecting your ovary to your uterus. It's a very muscular tube, and you can kind of imagine why it needs to move, right? So as it squeezes and moves along, it's going to move that oocyte further down towards the uterus. In addition, the cells in here are ciliated. If you remember what that means, it's the cells that have the really long finger-like projections that beat, kind of like in the respiratory tract, and it's going to help move that fertilized egg or unfertilized egg down the reproductive tract. Okay? So here's an example of what we're talking about as far as the ciliated lining of the uterine tube. All right, these cells are going to push the eggs or oocytes down the reproductive tract. Okay, so when we talk about the different parts of the uterus and the uterine tubes, this little catcher's mitt thing here, the one that's responsible for catching that ovulated oocyte, is called the infundibulum. All right, like I said, this little catcher's mitt, the fimbriae are basically the fingers of it. As you move further down, you have the ampulla, and finally the isthmus. Isthmus kind of being like a small throughway. Okay. Then you get to the uterus itself right here. And so you have the body of the uterus, which is the major section of the uterus. Then you have the fundus, or the top. Whoops. Then you have the fundus, or the top of the uterus here. Okay. As we go into the wall, you have the endometrium. This is what you shed every month when you get your period. All right, it's a mucosal layer. Then you have the myometrium. Now think about myo, right? What did we say MYO represents every time? Muscle, right? Okay, so then you have the muscular layer. If anyone is familiar with the uterus, you know that it's very muscular. All right, you need that, especially during labor. The canal, of course, the cervical canal, and then the cervix here. The cervix is kind of like the gatekeeper, and this is where they would check to see if you have, like when they do the pap smear, they're checking for cell growth here. Okay. In addition, some of the support structures, you have the ovarian ligament moving here. Okay. You also have the suspensory ligament moving towards the back, which holds a lot of the arteries and veins. You have the round ligament, which is very common to have round ligament pain when you're pregnant. All right, this kind of sits right in the gap where your hips are. You also have the cardinal ligament, the uterosacral ligament, and the mesometrium. We'll talk a little bit about these in class. But what I want you to remember is the three layers. So remember I talked about the endometrium here, the myometrium here. On the very outside layer, that is called the perimetrium, right? Like perimeter, like the outside. And this is just a serosal layer covering the uterus, okay? The myometrium, again, is the middle muscular layer. It's composed mainly of smooth muscle. You can't really tell your uterus to contract, right? It's not skeletal muscle. It's mostly smooth. And then finally, the endometrium, or what you're most familiar with, is the inner mucosa. Okay, and this is what is going to be shed every month when you have your period and you're going to have a new one. Okay? You have two layers of the endometrium. The topmost layer, the part that's going to be shed, is the stratum functionalis. All right, this is the superficial half, is what they call it. And this is the one that can either be thick or thin, and it gets replaced every month. The stratum basilis is the deep layer, and this stays behind, and this is what's going to be responsible for growing new stratum functionalis throughout the month. Okay? You also have a lot of vessels in the reproductive tract. We talked before, the ovary is highly vascularized because it needs to be, but so is the rest of your reproductive tract. Without getting a lot of blood to the system, you're going to have trouble supporting pregnancy. You're going to have trouble with your menstrual cycle. Okay? So the aorta here moves down the body, right? It connects to the ovaries via the ovarian artery. You can see it branching onto the ovary here. That can then split off and attach to the ampulla and isthmus here. Excuse me. Off the common iliac artery, there are branches. Okay, those are called the vaginal artery. This one will go straight to the vaginal wall. And then you have a uterine artery, which meets up here, and that's going to feed into the uterus. All right, so there's a lot going on here in order to get as much blood into the reproductive tract as possible. So, the vagina or birth canal, all right, it's down here below the cervix, is about 8 to 10 centimeters. Distensible muscular tube. What does distensible mean? For those who aren't familiar with the word, it means it stretches a lot. You should be pretty familiar with that concept. It can stretch quite a bit, okay? And this allows for discharge, okay? The contraction and the stretching allows for discharge of menstrual fluid, receipt of the penis and semen. Basically, it means it can fit the penis in and receive semen and allow the semen to travel up into the uterus. And of course, you need strength in the vagina in order to push the baby out during labor. There are different folds and ridges in the vagina. You have transverse friction ridges. Right, friction ridges sound very similar to what's on your fingertips, right? That's what they call fingerprints. The transverse friction ridges move across the vagina this way, right? And they're called vaginal rugae, and they're towards the lower end, all right? And then you also have mucosal folds on top of it where the hymen is formed. Okay, a lot of people have a misconception about the hymen. It's never fully closed. It's not a sheet moving across completely. It's usually just produces a very small space in girls who have not had sex, and over time, as you have sex, it stretches out further, okay, across the vaginal opening. So that's just an interesting fact. A lot of people get confused. So the hymen isn't actually like a sheet to be quote-unquote popped. It is a circular membrane that has a very small opening, and then as it's stretched out over time, you no longer get any tears or bleeding. So that's what they talk about when they talk about taking your virginity. Okay, so vaginal epithelium is pretty complex, or is not as complex as uterine epithelium, and we'll talk about the uterine epithelium later. But in childhood, it is simple cuboidal. That's it. As you hit puberty, the estrogens that your body produces transform it into stratified squamous. Okay, so children do not have a lot of protection in their vagina. It's just a simple layer. Okay, it's just one layer, which you can imagine if you have any friction in there, that it's going to cause damage very easily. Okay, once they hit puberty, however, that will transform into stratified squamous, and that is going to be there in order to protect against friction when someone's having intercourse. The other benefit is there are some bacteria in there that ferment glycogen-rich cells, allow them to produce an acidic pH. And you want an acidic pH in the vagina in order to, well, there's a few reasons, and we can talk about that later, but the acidic pH does help with childbirth, things like that, as well as other infectious issues. So next we're going to talk about the female external genitalia, and when we talk about that, we're referring to what's called the vulva, and that's not really a common term that people use every day. I hear it used more often in reference to female dogs, but in fact the exterior genitalia is referred to as the vulva. So first things first, you have the mons pubis at the top. All right, this is the mound of fat that lays over the pubic symphysis, and this is where most of your pubic hair is going to sit. Okay, then as you move down, you run into the labia majora. All right, labia majus is just going to be the one side. Labia is plural, so it's both sides. Labia majora. And there's a pair of thick folds of skin and adipose tissue that lays inferior to the mons here. Then then you have the labia minora, which is the interior folds. Okay, these are medial to the labia majora, and these are hairless. Okay, and then at the very top of the labia minora, you have the clitoris, and this is made up of erectile tissue that creates more of a sensory organ, but there's really no urinary role for it. Additionally, in between here, you have what's called the vestibular bulbs, and they're deep to the labia majora. Okay, so the larger one, they're inside there. They are erectile tissue. Okay, and their purpose is to cause the vagina to actually tighten around the penis in order to enhance sexual stimulation. And then you have the greater and lesser vestibular and periurethral glands that open into the vestibule, the space here between the labia minoras, for lubrication. All right, those glands are going to be providing a lot of lubrication. And then on the inside, you have the orifice, and then again, the hymen. Okay? Okay, as we move further inward and we're talking more about the tissues underlying it, you have again the pubic symphysis at the top. You can see where the two hip bones are fused together with fibrous connective tissue. Then at the very right below that, you have the clitoris, and the glands, and the crus. The crus is the V shape that you have there, and then the glands is the center bulb. Okay? So here we're just showing you where the greater vestibular glands are. The periurethral glands, they call it periurethral because it's found para next to urethra. The urethra. Okay? You have the urethral orifice in the center. Then on either side of your urethra, you have the vestibular bulbs that we talked about. All right, this is the erectile tissue. You have the vaginal orifice in the center. And then just to give you direction as far as the bones, you have the ischial tuberosity of the hip bone, the very back end. All right, and this is what sticks out on your butt, especially if you're super skinny. Please excuse any dog sounds in the background. Okay, so then we're going to talk about your breasts and the breast and mammary glands. These are a lot more straightforward. The breast is the actual mound of tissue that lays over the pectoralis major, right? So a lot of times this is adipose tissue, and there's very little actual mammary gland, okay? This is what's going to enlarge at puberty and remain there for life, but the mammary gland is only going to develop during pregnancy, okay? So your breast develops during puberty, but your mammary gland develops during pregnancy. So that's kind of a key quiz question, you might say. Okay, so the mammary gland is going to remain active while you're breastfeeding or lactating, okay? And then it atrophies when you stop nursing, all right? So that's what you're familiar with when your breasts swell when you're pregnant, and then when they go back to their normal size later. Okay. So there's two principal regions of the breast that we're going to talk about. We're going to talk about the body, which is the conical to pendulous shape where the nipple is at the apex, all right? So that's the body. And then you have the auxiliary, or what some people call side boob, all right? And this is the extension towards the armpit that a lot of people are familiar with, especially if you wear strapless dresses. You notice this a lot, okay? And there's a lot of lymphatics in the auxiliary tail that are really important, especially when we're talking about breast cancer metastasis, all right? So those lymph nodes and the lymph system in there can actually contribute to breast cancer metastasis. Okay, so we're not going to talk too much about hormones today. We're going to just touch on them a little bit. We've gone over these before in AMP1, so it should be somewhat of a refresher for you. So puberty begins between the ages of 8 and 10 for most girls in the US. This can change by a lot of different factors. Different countries have very different ages for puberty. Different communities have different ages for puberty. There's thought to be some genetic disposition to when girls go through puberty. There's also some environmental factors that are thought to contribute. I believe the youngest girl to go through puberty was 3 years old, which is insane to me, and terrible to have to go start your period that early in life. But again, some people, it doesn't start until much later. So this is kind of the average between 8 to 10 for most girls in the US. It's triggered by increasing GnRH. Now, if you remember, the GnRH is produced by what? Yeah, okay. So I know that you guys don't remember this because a lot of people forget this in AMP1 by the end of the semester, okay? GnRH is produced by the hypothalamus, which targets the pituitary, the anterior pituitary, to produce FSH and LH, all right? FSH stands for follicle stimulating hormone. LH stands for luteinizing hormone. And these guys kind of work in concert together to lead to your menstrual cycle, your ovulation, as well as sustaining pregnancy, okay? So when we talk about FSH, that's the guy that's going to be selecting ovarian follicles for development, okay? He's going to be saying, all right, it's time for you guys to start developing from primordial follicles to oocytes, okay, to ovulate. So once the FSH starts developing the follicles themselves start to secrete estrogen, progesterone, inhibin, and some amount of androgen. Not a lot, but some. Estrogens are what we call the feminizing hormones, and these are going to have wide effects on the body. We won't talk about them right now, but they have a lot of effects, especially in puberty, okay? So when you start to produce GnRH, your body produces FSH, which triggers this estrogen production, okay, as well as these other hormones. And the estrogens are what's going to start triggering a lot of the puberty effects that you see when you're going through that stage in life. Okay, so when we talk about puberty, there's three main kind of, maybe not steps because they're not necessarily in order, but three main effects that are seen. Okay, Thalarc is breast development and is possibly the earliest noticeable sign of puberty. Now, again, everyone, you know, at any age, it can be different. So maybe you start breast development young, and your breasts become very large, maybe not, and so it's not as noticeable. So for some people, this is perhaps the earliest sign that puberty has begun. Pubarch is the appearance of pubic and auxiliary hair. When we talk about auxiliary hair, we're talking about any hair that's really not on your head, and so it can be armpit hair, okay, pubic hair, and even thickening or darkening of the leg hair. Okay, you also get sebaceous glands, and sebaceous glands being oil glands, and axillary glands, axillary glands being like the armpits again. And so this is when kids start to smell and you're like, okay, time for you to start using deodorant. All right, this is another sign of puberty. And then menarche is what most people refer to as the first sign of puberty. This is your first menstrual period, okay? So it requires at least 17% body fat in teenagers and 22% in adults. And actually, for people who suffer from anorexia, they actually don't undergo menstruation at all, or they'll have very irregular menstruation, and it's very dangerous for them to be at those weights. The first few cycles, usually there's no egg that's ovulated, so they're considered anovulatory, right? You add an A in front of the word, and it usually means none or no or some sort of negative, okay? Anovulatory. It is not ovulating an egg, right? Your body's just kind of going through the motions, getting ready. Usually after about a year is when they start menstruating, okay? I'm sorry. Usually after about a year is when they begin ovulating during menstruation, okay? So if we go back through these, Thalloc is breast development. This is when you're going to get initial duct and ovular formation. All right, completion of the duct is stimulated by glucocorticoids and growth hormone. And then adipose and fibrous tissue complete enlargement by about the age of 20. Okay. Now, pubarch is usually triggered by the androgens from the ovaries and the adrenal cortex. Okay. And then menarche, there's a lot of different stimulation. So body fat is required in order to produce the gonadotropin secretion. So that's why if you do not have enough body fat, GnRH isn't going to be released. You're not going to go through menstruation. And improved nutrition has a lowered age of onset to age 12. So if you are healthier, you may see a different onset of puberty than you would otherwise see, or menarche. So this is pretty much like the last bit of hormones we're really going to go over before we talk about in class. All right, you have estradiol. Estradiol, a lot of you guys have heard before. I believe it's beta estradiol that they put in birth control medication. So estradiol is a hormone that's produced during puberty, and it stimulates the vaginal metaplasia. So metaplasia is the growth of cells, okay? Growth and expansion. So when we talked before, we said before a child goes through puberty, their vagina is made up of simple cuboidal, so they can't really tolerate a lot of friction there. But once you go through puberty, you go through vaginal metaplasia where your cells become stratified. All right, and this stratification allows you to deal with a lot more friction during intercourse. In addition, estradiol stimulates growth of the ovaries and secondary sex organs. Okay, and then stimulation of growth hormone secretion. So this is to help you increase your height, widen your pelvis, get those good childbearing hips, and can also contribute to the feminine physique because it creates deposition of fat in locations that most women carry it. Okay. In addition, it can make your skin a little thicker, but will be still a little softer than that of male of the same age. Okay, progesterone. Again, usually your birth control medication is both the estradiol and progesterone. Okay, so progesterone mainly acts on the uterus, preparing for pregnancy in the second half of the menstrual cycle. And so progesterone is what they like to call the pregnancy maintaining hormone. Okay. Now, both of the estrogen and progesterone have a negative feedback inhibition on FSH and LH. Okay, so FSH and LH trigger the production of estrogens and progesterone. Once there's enough of these estrogen and progesterone, they go back and they turn off FSH. They say, hey guys, we have enough. You don't need to produce any more of us, so stop producing FSH and LH. Similarly, inhibin, which is also produced through this process, just shuts off FSH. Okay, so it won't affect LH. But when you have enough estrogen, estrogen will feed back and shut off FSH by producing inhibin. It's a little complicated. We'll talk about it in class more. I just wanted you guys to touch on it. And this is very cyclical and a little complicated of what is triggered when. And again, we will talk about that process more in class. We're going to talk briefly about the climacteric and menopause. So during like your midlife, okay, there's a change in your hormone secretion, and this is accompanied later on by menopause or a lack of menstruation. So, like I said before, you're born with so many eggs, right? As you ovulate, you lose those eggs. So, climacteric is kind of the onset of when you only have about 1,000 follicles left. And there are side effects that you see from this, and oftentimes it's hormonal side effects, right? So in order to regulate that, people are provided with hormone replacement therapy, okay? So some of the common side effects that you're familiar with, bone mass decreases leading to osteoporosis, get hot flashes, cholesterol levels rise, you get increased risks of cardiovascular disease. So all the things you're common seeing in women past middle age are a lot of the time symptoms of this climacteric and lack of follicles. When we talk about, this is a slide we went over before, when we talk about oogenesis sex cycle, again, you have the reproductive cycle and then the sexual cycle. So we went over the ovarian cycle and the menstrual cycle. Let's talk a little bit more about actual oogenesis itself. Okay, so oogenesis is oo as in oocyte, genesis as in production. Okay, so oocyte production, egg production. Now, we'll talk more about meiosis later, but what you need to know is the oocytes are called gametes, all right? And gametes have half the DNA you need, right? Your mom gives you half her DNA, your dad gives you half his. Those are gametes, half the DNA. They're meant to go together to produce a full set of DNA to make a baby, right? Okay. So the production of these eggs is cyclical, again, pretty much everything, and normally you release one egg each month. This then later affects your hormone secretion that month, and it actually changes the histological structure or the microscopic structure of your ovaries and uterus. They change. So to sum it all up, you start with a ton of eggs. They just sit there until puberty. By puberty, you have about 400,000 oocytes. That's supposed to be a lifetime supply, right? For 480 times of ovulation. Some have more, some have less. It depends on how long you go without reaching menopause. Okay, and then egg development resumes in adolescence. So you have the primordial follicles. They're already there. They're not going to grow. They're not going to make more of those. You have what you have. But when you reach adolescence and puberty, those follicles will start developing a little bit. Okay? So the FSH stimulates groups of these oocytes to go through the process of meiosis. All right? That's basically dividing up the DNA. And it's important to produce an egg that has a lot of cytoplasm as possible. Think about it. This egg is going to be responsible for then growing into a fetus, right? So if it's a very small egg and doesn't have a lot of mitochondria, doesn't have a lot of lysosomes, it's going to be very difficult to support life. However, if it's large, it has a lot of cytoplasm, a lot of mitochondria, it's everything it needs to grow, then it's going to be able to support life once it's fertilized. If it's fertilized, it then has to divide rapidly and produce a number of daughter cells. Think about it, you have one cell going into a human being, right, turning into a human being. So it has to be prepared to divide. And the chromosome of the larger egg will unite with those of the sperm. So like I said before, the egg is half the DNA you need, right? After that, you're waiting for the other half, which comes in what form? The sperm, right? So the sperm needs to deliver the other half of the egg in order for the other half of the DNA in order for the egg to begin dividing. And again, apologies for all the dog sounds in the background. So this is a really helpful picture of the breakdown of oogenesis and follicular development. We will go over this more in class, but what we'll just talk about quickly is you again start with primordial follicle. You then move into primary and secondary follicle. The tertiary follicle is the largest, and this is where you want it to be very healthy and very large cytoplasm. Then you are able to ovulate, leading to the corpus luteum and the egg moving through the fallopian tube. Okay? When we talk about the histology or the structure of the ovarian follicles, this is basically a tertiary, I believe this is a tertiary follicle. It looks like one. Yes, it is. Okay, so in the center, the very, very center, that little bullseye, that's the actual nucleus of the oocyte. Okay? So how much DNA does it have? Half, all right? It has half the DNA. It's a gamete, it's only half the DNA. All right, so then surrounding it, that's the egg itself, that's the sex cell, okay? Around that, you then have what's called a zona pellucida. Okay, zona just means like an area, pellucida. Then we go out one more, you have a cumulus orifice, this like nice little ring around it, okay? Then you have the antrum, which is very large. You can see that, and there's a lot going on in there. Then as you move out further, you have granulosa cells, and then finally you have theca folliculi, all right? So this is the overall structure of the ovarian follicles. So that's all we're going to talk about today with the female reproductive system. We will talk more about the male reproductive system in just a minute. So next we're going to talk about the male reproductive system. And I'm skipping ahead a little. We're just going to do the anatomy. So I'm starting, this is chapter 27, slide 15, okay? So we're just going to talk a little bit, real quickly, of the male reproductive system and what's going on there. So you have the bladder here, which is very similar to the female, right? The pubic symphysis, again, very similar. But then you have what's called the root of the penis, all right? This is the base. And then the penis moves forward into the shaft, and then the prepuce, okay? So those are the main sections of the penis. And then we're going to talk a little bit more about the testes, what their structure is like on microscopic level. The scrotum you're familiar with. We're going to talk about why these things move, why the testes move up and down when it's hot or cold. It's actually very important for sperm production. It's not just a nice joke on Seinfeld. And then we're also going to talk about the different ducts that are important for reproduction as well as sperm production in general. Okay? So when we talk about the scrotum and the spermatocord, all right, we're talking about this area right here in where the penis is not actually included. So it's where we're talking about the testes. So the spermatocord, you see at the top left, the in blue, called the cremaster muscle. The cremaster muscle makes up the large amount of movement in the testes themselves inside the scrotum. And then within the spermatocord, you also have the testicular artery, the ductus deferens, and the pampiniform plexus. I know that's a mouthful, but to be honest, it's really important. So the pampiniform plexus, you will definitely need to know. All right, we'll talk more about what those items do. So when we talk about spermatocord, sperm have a very sensitive temperature at which they can be produced, all right? Which is why the scrotum sits outside of the body. It actually needs to be about 2 degrees cooler than body temperature. And I believe that's Fahrenheit, not Celsius. So the cremaster muscle, like we talked about before in this previous picture at the top, actually encases the pampiniform plexus, the ductus deferens, the testicular artery, and the testes themselves. Okay, what happens is the cremaster muscle will contract and pull the testes closer or further away from the body, depending on what the ambient temperature is around the testes. All right, so if it's too hot, they're going to hang lower, further away from the body to try and cool. If it's too cold, it's going to try and pull it up closer to the body to try and sit at that nice 2-degree difference. All right. The dartos muscle is a layer of smooth muscle that controls the actual scrotum itself. So the sac in which the testes sit, the dartos muscle will cause that to shrink up. And again, it's for the exact same reason. It's trying to maintain that temperature of 2 degrees cooler than body temperature. All right. The pampiniform plexus is actually a really clever air conditioning system, we'll say, for the testes. All right. And it's these vessels and veins. And what it does is it's set up in a way to cool the incoming blood down 2 degrees in order to keep the testes at 2 degrees lower than body temperature. So as it comes down towards the testes, the pampiniform plexus cools the blood down 2 degrees when it reaches the testes, and then it moves back up. As it moves up, it cools the incoming blood. All right, so it's actually a very clever system. This is kind of a heat exchange that I was talking about. So on the left, you have the blood coming from the body. All right, so it is Celsius. My apologies. So you have 37 degrees coming down, right? That's body temperature. As it moves down the scrotum, it's going to pass the venous blood that has just been down the scrotum where it's cooler. And that cooler blood that's passing exchanges heat and helps to cool that blood moving into the testes. That way it's cooler when it reaches the testes and it doesn't overheat the sperm. It's actually a really clever system. All right. So the shrinkage that everyone talks about is caused by the cremaster muscle pulling the testes up and the dartos muscles contracting the skin of the scrotum. Okay, and this is in order to keep it as close to that 35 degrees as possible. Again, dogs. Okay. So there's a lot of structures in the testes, and I think this picture is hilarious because it always reminds me of ramen noodle with the color they picked. Sorry if I ruined soup for you for the next, I don't know, year or so. But the testes is a combined endocrine and exocrine. So if we remember what that means, endocrine means it stays in the body, right? The hormones stay in the body. Exocrine means that it produces things that leave the body, right? Whether it's going into the gastrointestinal system, right, into the gut, or if it's leaving through ejaculation. Okay, so endocrine and exocrine. So at the top of the testes, you have what's called the head of the epididymis. A lot of the noodle-like vessels will meet here. Okay, and this is where a lot of the sperm are going to develop. And then it moves up through the ductus deferens, and that is where it's going to move to the penis. Okay, so here is a larger picture of the actual anatomy, gross anatomy. Remember what I said, gross just means large, so you can see it with your eyes instead of using a microscope. So here you have the testes, and they're actually covered with something called the tunica albuginea. Ginea. Oh goodness, ignore me. You can read it. Tunica meaning a sheet or a covering, kind of like a tunic that you would wear, right? Albu meaning white, okay? So, like albino, okay. So it's covered with that. Then sitting right above it, you see this little sac. That sac above it is the epididymis. If you were to cut this open, you would see all those noodles that we just talked about, and that's where all the sperm production is being is being run, okay? So it then collects in the epididymis. It helps to develop further and the sperm mature a little bit more, and then they move up the ductus deferens into the penis, okay? So interestingly, orchids, which I think is funny because orchids are commonly, these days, the flower themselves are related to females, but they're named for their resemblance to testes because if you look at the roots at the bottom, they look like testes. Okay, so anytime you hear orchio or orchid, it's referring to testes. So maybe you've heard orchiectomy, so removal of the testes. This may occur like during testicular cancer. Another common problem, especially in kids and actually in dogs, is cryptorchidism. Crypt meaning hidden, and then orchid meaning testicle. And what this is just an undescended testicle, so a testicle that still sits in the abdomen. You can imagine this being problematic for sperm production because what temperature is your abdomen? Body temperature. And sperm cannot develop at body temperature. They need to be cooler. So cryptorchidism can lead to sterility or fertility issues if it's not corrected. The cells in the tissues, so in the tubules, they're going to be interstitial cells or Leydig cells. And these guys are going to be producing the testosterone. These guys kind of sit on the outside of the tubules surrounding them. And these are kind of the support cells that are going to be producing this testosterone that's going to keep them going. Okay? Within the tubules, however, you have two very important cells. You have germ cells. So these are the stem cells that are going to turn into sperm. Okay? Obviously, you need stem cells to make the sperm. Okay? So they have to be there. Then you have these cells called sustentacular cells or Sertoli cells, or more commonly, nurse cells. They're called nurse cells because they produce a lot of different benefits for the testes, okay? They support and nourish the stem cells, known as germ cells. They support those. They also create a blood-testes barrier. You can imagine if you're changing the DNA as far as splitting it in half, your body's going to think it's not your DNA and it's going to want to attack it. So you need to protect your sperm by creating a barrier, just like the blood-brain barrier, okay? Just like in women, you need a barrier when you have a child because your body will attack something that's not itself. Your baby definitely isn't you. Your body needs that protection from the immune system. And in fact, testes need that as well. In addition, the nurse cells produce inhibin, and this helps to regulate sperm production. Okay, so these guys do a lot to support the germ cells that are producing sperm. So as I talked about before, the blood-testes barrier is very important. It's created by these tight junctions between the nurse cells or the sustentacular cells. I think sustentacular, nurses are just sustentacular. Yeah, whatever helps. So the tight junctions formed between these cells do not allow immune cells through, and it also prevents a lot of molecules and bacteria from getting in as well. So overall, it's just beneficial to protect the stem cells that are growing from being under attack. So it separates the sperm from the immune system, prevents antibodies and other large molecules in the blood from getting to the germ cells and affecting them. Because, as I said before, these germ cells do not look like you because they're making new DNA, essentially. They're making cells that don't match your DNA perfectly. All right, they only have half of your DNA, so they don't match your system. So if they were ever exposed to your immune system would attack them. All right, and that is no good. Okay, when we talk about the duct system, I kind of talked about it already. You have the efferent ductals. That's all those noodles we talked about in there. All the ramen. Okay, and there's about 12 ciliated duct system that will be collecting the sperm from the reedy testes and transporting it to the epididymis. All right, that's a lot. So just think of it, there are about 12 ciliated ducts that help move sperm along from the ramen noodles to the epididymis, right? The epididymis is where all the ramen noodles get really compact. So it moves to the epididymis, and then it moves further into the ductus deferens or vas deferens, okay? When we talk about vasectomies, we're talking about the vas deferens, all right? Vasectomy, all right? That's where the cut is made. It's in the ductus deferens. Okay, so when the sperm move from the efferent ductules into the epididymis, they will then mature and store in the epididymis for about 40 to 60 days. Okay, so if you, I don't know, spend a really long time in a sauna, for instance, and your testes become too hot and it kills all your sperm, it will take anywhere from 20 to 60 days to develop a new set of sperm to produce. Okay, does that make sense? So men are always producing sperm. Meanwhile, women are born with all their primordial follicles. Okay, so that's kind of a major difference between the male reproductive system and the female reproductive system. Okay, after they develop, they go to the vas deferens, which is that tube that launches it towards the penis. Before it gets there, it goes through what's called the ejaculatory duct, where it's then combined with other ejaculatory liquids to produce the semen. And then it moves through the penile urethra in order to be ejaculated out into the female. Okay? Okay, so the male urethra, we've talked about before. There are three main segments, okay? Prostatic, which is the section near the prostate that goes in between the prostate, right? Membranous is the section that's still in the body, past the prostate, okay? And then finally you have the spongy urethra or the penile urethra. This is the part of the urethra that moves through the penis itself. Again, much longer than the female urethra, about 18 inches, okay? Or, I'm sorry, 18 centimeters long. And because of that, it's a lot harder for men to end up with UTIs because bacteria have difficulty traveling that far in such an environment. Okay, so we're going to talk about the accessory glands really quickly. You have the seminal vesicles, which are a pair of glands posterior to the bladder. It empties into the ejaculatory duct, like we talked about before, and this is what's going to form 60% of the semen. Okay, so the sperm moved down, and then the seminal vesicles release into the ejaculatory duct as well, and there you have 60% of your semen and your sperm all together. Then you move further down, and as you're moving down, you move through the prostate gland. Now, the prostate gland surrounds the ejaculatory duct, all right, and it produces about 30% of the semen because it creates this thin, milky secretion, okay? And then you move into what's called the bulbourethral gland. For some reason, this name seems to stick in people's heads really well. But yeah, bulbourethral gland, and it's a bulb. It's near the bulb of the penis, okay? So during sexual arousal, it creates a clear fluid that lubricates the head of the penis. Some people call this pre-cum. And it protects the sperm by actually neutralizing the acid from the urine that was previously in the urethra. Okay, so when you pee, there's going to be some residual urine in there. The pH is going to be acidic. Sperm do not like acid. And so, in order to prevent killing all your sperm before they leave your body, the body produces fluid in the bulbourethral gland, this pre-cum, that will help to essentially rinse out the urethra and neutralize it. Now, this is the big question. A lot of people say you cannot become fertilized from pre-cum. This is not true, okay? Because while urine can be left in the urethra, so can sperm from a previous ejaculation. So if the guy ejaculated earlier that day, I don't know how long they last in there, but the thing is, if they ejaculate earlier that day or that night, and then they ejaculate, the pre-cum then moves down into the urethra, it's going to wash with it whatever remaining semen was in there. So it is, while it's a low concentration of semen, you can actually get semen in the pre-cum. And because of that, you can become pregnant by having sex with someone if you are exposed to pre-cum. Remember, you only need one sperm to get you pregnant. So it is possible. So that's where the confusion is between whether or not pre-cum can make you pregnant. It can if it's carrying residual sperm from a previous ejaculation. So put that in your pipe and smoke it. Okay, so the structure of the penis, now we're going to talk about the actual penis itself, is important for depositing semen in the vagina. Pretty straightforward. There's an internal root of the penis, which we showed you before in this previous section here, that's actually embedded into not the abdomen so much as just below the abdomen. My brain is blanking. Please excuse me. So you have the root, which is internal. Just remember that. Then you have the external visible shaft and glands. So the skin over the shaft is loosely attached, allowing for expansion. So as the penis becomes erect, it's going to expand and stretch. And because of that, it allows for the loose skin allows for movement. It also tends to extend over the glands or the head of the penis, right? And it's going to be the pubis. The skin is going to be the pubis, also known as foreskin, usually removed by circumcision. There's been some new research out talking about the benefits of circumcision. They found that individuals who are circumcised actually have about 60% lower chance of transmitting HIV, as well as a decreased chance of transmitting other STDs, because a lot of it was growing inside the space in the foreskin. So with circumcision, they found transmission rates of HIV have lowered dramatically in third world countries, and they're doing more research here as well to see the benefits. But yeah, it's becoming more and more recommended when discussing STIs. Even adults are doing it, which is, it sounds awful. So when we talk about internally, there are 3 erectile tissues, okay? You have a set of dorsal corpora cavernosa, okay? You have ventral corpus spongiosum, where the urethra sits, and then you have blood sinuses called lacunae, which sound familiar to chondrocytes, but lacunae are holes that cause the erection themselves, okay? And these are the blood sinuses that are going to fill with blood during the erection, okay? All right, so then you, Thanksgiving family. Okay, excuse me, if you can actually hear my family in the background, I apologize. Okay, so they're yelling at the dogs that are trying to eat the food. Anyway. So here is a nice structure of the penis that you can see a little bit better. So to look at the transverse cut, what you see is the very large gap there, or the very large, what look like eyes. That is the corpus cavernosum, okay? At the base is the corpus spongiosum. And then you have the tunica albuginea, that are encasing both of them, okay? And then in the center you have the deep arteries. So those are the major structures in the penis. And then on the left side you can see where the glans penis is. Like I said, a lot of people refer to it as the head of the penis. Technically it's considered the glans penis, okay? So talking about puberty in males and climacteric in males, the reproductive system remains pretty dormant several years after birth, okay? It doesn't do a whole lot in the males until it starts to reach adolescence. So In adolescence, the gonadotropin starts to be secreted and the reproductive development begins, okay? This will continue until the male reaches full height, which can be into the 20s, right? So puberty is decided as the first few years of adolescence, okay? Until the first menstrual period in girls or the first ejaculation of actual sperm in boys. So remember when we talked about girls will menstruate and they may not release an egg? Well, men will ejaculate and not release actual sperm until a little bit later on, okay? So it's not right out the bat the first ejaculation viable sperm, okay? And there we're going to stop. So I hope you guys have a great Thanksgiving. I will see you afterwards. And I hope you guys enjoy your break and seeing family and eating lots of food. But yeah, I will see you next week. Have a good one.